All right. We are going to get started today, guys. Welcome, everyone. Thank you all so much for coming. Um, so, if some of you were in attendance last month, this one didn't go so well. We had a lot of tech issues. But again, my name is Dave Gunas. As you see there on your screen, I'm the ACA Sales Director here at Pinnacle Financial Services. Um, Today, we're going to talk about Health Sherpa enrollments, basically doing an app all the way through on Health Sherpa. Okay, now what Health Sherpa is, just a slight background on Health Sherpa. They are what's called an EDE, an Enhanced Direct Enrollment Platform for ACA enrollments. Okay, and they have a Medicare side now too. But anyway, um, healthcare.gov, when you take your cms.gov training, your FFM, your federally facilitated marketplace training, if you don't know what that is, we can definitely talk about that after. But once you do that, that gives you access to create an account on Health Sherpa. It actually allows you to sell on healthcare.gov, but that can get pretty complicated. That's a direct enrollment, just a DE basically platform, right? The enhanced direct enrollment platform like Health Sherpa, the most popular one in the entire country, most used. So we highly recommend it for any ACA enrollments. So that's an enhanced direct enrollment platform. So Health Sherpa is your best bet to write ACA policies in any states that are on the federal exchange, and some that have a private, like Georgia, but we could talk about that later. So just to come back a minute to the webinar here, two things I have to mention. This webinar is being recorded, okay, and everybody is in listen-only mode. Now, if you can see, there is a questions tab. You could submit any questions you want throughout the webinar. What we're going to do today is just simply watch a video by a trainer named Amber from Health Sherpa directly. Okay, there is no training sandbox, so to speak, on Health Sherpa. So I actually couldn't even walk you through an application on my own to get you all the way through an app, right? There is no sandbox, no training environment for agents to practice all the way through to the end of an application, getting the eligibility approval and so forth, and submitting an application. So we have to actually watch their training, which is excellent. Amber is awesome. I highly recommend taking her trainings. You can go directly to the website when you're a listed agent, or rather have an account on Health Sherpa. Okay, so again, this webinar is being recorded. Everybody is in listen-only mode, and you will all get a copy of this. As long as you've been registered for the webinar, you will get a copy of this within 48 to 72 hours, I'll say. Okay. So in the interest of time, we're just going to jump right into her training. Okay. Now, again, you guys can ask any questions you like. I could pause the video and answer, or we'll wait to the end and answer any questions that you may have. Okay. Please keep in mind too, any specific questions or even actual real life situations where you maybe want me to help you through an app with an actual client, I can do that as well with you at another time. But today, just the basic training on an enrollment straight through to the end. But again, only can be done by Health Sherpa staff. So we're just going to watch her video, and Amber is awesome. All right, so give me 1 sec. Let me switch screens here.
Okay, we are going to move into the quoter. So first things first, I'm going to come up here and click on my quote button. So reminder, the quote button is really cool. Anytime my consumer kind of wants to look at all the plans that are available to them before we start the subsidy portion of the application, right? So they might not want to talk to me about, their social security number all just yet. They might just want to see all the plans. That's okay. What I think is super cool about the quoter is it's dynamic. So depending on the information I provide, I'm going to get subsequent follow-up data, right? For example, if I type in an income of $45,000, watch what happens over here on the right. I get a subsidy estimate an eligibility estimate that looks like advanced premium tax credits of almost $300 a month. If I adjust my income, let's move it down to 35. Look at that. My eligibility estimate also adjusts. The other cool thing is it's reminding me of things along the way. We all know, right, as licensed agents, that there are actually two types of subsidies. There's that advanced premium tax credit, and there's the cost share reduction. It can be really hard to remember all this stuff, right? You, the agent, are expected to remember so much stuff. The quoter is actually telling you, hey, look, there's two rows. Look, this one's cost share reduction. This one's the advanced premium tax credit. You'll also notice you have some dashes under the words. If I just hover, I get a reminder of what's meant by this row. I also get a reminder if I hover over cost share reduction, hey, look at those last four words, for silver plans only. We know that the advanced premium tax credit can be applied to any metal level, but the cost share reductions, those are only good on silver, right? Let the platform take a lot of the pressure off of you, the agent. You have so much to keep track of. Let us help you with this stuff. So you can hover anytime you need that nice reminder. The other cool thing I like about the quoter is I can let Health Sherpa be the bad guy. I don't have to do it. I don't know about you, but getting people to answer this tobacco usage question is often very sticky. You can easily hover over this and say, hey, consumer, this is how the marketplace defines tobacco usage. How do you want me to attest to this on your behalf? I'm your licensed agent, right? I'm not a mind reader, not a fortune teller either. So this is your application. I'm just attesting on your behalf. Let us be the bad guy. Anytime we can take that pressure off of you. You're also going to see these little tooltips by way of the question mark with the circle. So if you ever see those, you can hover and you'll also get a nice little tooltip there. Scrolling down, you notice you've got lots of different filters over here on the left. You're on our plan results page, this plan shopping page. I can certainly sort by carrier. Health Sherpa is going to be required to display all available carriers. That's a CMS requirement. But if you want to filter down to certain carriers, you can. If you want to filter by metal level, you can do that too, right? Especially helpful if you know your consumer's cost share reduction eligible. You've got networks and a few additional filters down here too. You also have some filters over here. So if you want to sort maybe by lowest out-of-pocket maximum, you can do that. Really, however you need to shop in a way that prioritizes your consumer's needs, you can do that. The other cool thing that I think exists within our plan shopping page is the provider and medication lookup tool. So if, for example, oh golly, there we go. If your consumer is, let's say, just curious about a certain hospital, right? Maybe it's, I don't know, this one. You can add it, right? You'll quickly see if the provider is going to be considered in-network for the plan. If, let's look at this, we're looking at 46 plans. If this is a deal breaker provider for your consumer, maybe they only want to look at plans where this provider is going to be considered in-network, check the box. Your view is going to change. Look at this, now we're down to 21 plans. Now you're only going to be looking at plans where this provider is going to be considered in-network. Really nice way to shop in a way that is prioritizing the needs your consumer is sharing with you that they have. Similarly, with medications, what I think is cool about this is it reminds me, first of all, that there's like 100 medicines with this name. So for first things first, I probably need to ask them follow-up questions. Hey, consumer, do you take the delayed release? Do you take whatever this other thing is? Cool. I talk to them and they say they take this one. Awesome. What's your dosage? Looks like we've got a couple different options available here. So again, it really helps. They get a 3-month supply, take the pressure off of you, the agent, to remember all these other follow-up questions, right? And you can see this will all just display right here within the plan card. The other really nice thing is you can dig into the full plan details if you need to. I'm going to open this in a new tab just so you can quickly see what that looks like. But it's a really user-friendly version of kind of what you would find in the summary of benefits for a plan, which, by the way, you can still get to the summary of benefits for these plans. They live right here in the plan details pages. So everything is still all together for you. It's just a little bit more of a user-friendly version whenever you are helping your consumers shop. You can also compare plans. You can actually compare up to 5 plans at a time. So again, if you do want to dig more into the quoter, you're welcome to do that. Feel free to pop into our Selling ACA Plans webinar. So I'm going to come up here back to our dashboard. Actually, before I do that, one other call out. I'm able to simply add a plan to my shopping cart and cruise right into the subsidy application anytime I'm ready to do that. Today, though, I want to show you the full experience. So I'm going to come over here to our dashboard, and I want to show you what it looks like if you want to start with the subsidy application. So over here, you've got Start Application and Search Marketplace. Ostensibly, these are the exact same thing, so I'm just going to show you both. First, I'm going to click on Search Marketplace. Okay. All I want you to do is take note of the fields that you see for just a moment. First name, last name, date of birth, state, couple checkboxes, and a search bar, right? Okay, we're going to go back to the dashboard. Don't panic, we're going to get to that in just a moment. Start Application gives you the exact same fields. First name, last name, birthday, state, a couple checkboxes, and a search bar. Whichever one you want to do is totally fine. They're gonna give you the same path. Okay, so who have we not picked on lately? I don't know if I'm spelling this name right, but I don't think I've picked on this person ever. So I'll go ahead and start fresh today. Okay, of course we know that we need to have consumer consent to work on their behalf. We need this consent documented even before we can search the marketplace on behalf of a consumer. If you still need to document this initial consumer consent and you need help doing that, you're absolutely able to download a consent form, or you can go ahead and pop back into your consent library and go ahead and send digital consent to your consumer for this initial consumer consent. Just make sure you have it on file before you check this box to search the marketplace. Let this checkbox be a reminder for you. If you'd like to include prior year applications as well, you can do that. So we're going to search the marketplace. Shockingly, this consumer does not exist. If they did exist, I would be able to simply grab their existing subsidy application and update that with my consumer. I do not need to start a whole new application anytime I'm helping a new consumer, right? If they have an existing app, I'm welcome to say, hey, this one looks like it's already out there. Can we grab that to update together, right? Get their permission, and then you can cruise on through. So today we're going to start a new application. We'll have some pretty standard privacy statements. We'll read through these with our consumer. Our consumer agrees. And now we can again talk about this initial consumer consent. Recall that CMS says consent exists in 2 parts, right? There's this initial consumer consent, and then down the road, there's eligibility application review consent. So when we're just looking at this initial consumer consent, we know we needed it on the last page, right? So perhaps actually I already have consent in my library that I'm just wanting to upload here because I've already, collected it before we started this process. Maybe at this point I want to go ahead and email consent to my consumer, text consent to my consumer. I can absolutely do whatever I need to do here. Maybe I have it already documented somewhere else, not in my consent library. I just need to upload it. And perhaps I already have it in my own records, and that's okay too. You'll notice you still have the option to download a consumer consent form here. So however you need us to help you manage this, we're happy to do. Just make sure you keep it on file for the recommended time that CMS specifies. Okay, so we will go ahead and say we are applying for coverage. If we're not applying for coverage, social is technically optional. However, it is still recommended for the household, right? If you have any questions about that, feel free to pop a question into the Q&A feature of our webinar. So today we are applying for coverage. We know that social is required for all applicants who have been issued a social. If you are assisting a non-US citizen who does not have a social, that's totally fine. You are able to say that they do not have a social here, and then you can provide their immigration documentation on subsequent pages. Okay, we've got lots of different options available here. We can add a different mailing address if we need. We'll get a nice little address confirmation box. Several different phone types. lots of different languages, both written and spoken. There's also an other category, so you can truly capture your consumers' preferences here. Perhaps we'd like to get notifications about our application via mail. We'll sync up with the marketplace. Now, because we are in our testing environment, the social that we've used on this application, it's just a testing social. It's just a dummy social. So a lot of times our prior entries on these testing applications get saved, as you can see here. If you are completing a brand new application, will not have this view. I will show you the view that you will have. If you are updating an existing subsidy application, you'll likely see a lot of these summary pages where you can still just edit these sections if your consumer needs to make a change. Okay, so we do want to see if we're eligible for tax savings today, for cost savings, I should say. If we have additional folks applying for coverage, we can add those people. If, let's say, you are assisting someone with a complex tax household circumstance, perhaps, their neighbor's niece is living with them now, and they're going to be claiming that dependent on their taxes. Look at this section here. It says, this person is your... Okay, look at all these different relationships that are listed. So many. And my favorite too, are at the bottom, other relative, other unrelated. So if the neighbor's niece is living with your consumer for a bit, they're going to be claiming that person on their taxes. Great. You can still absolutely help them to add this dependent on their subsidy application. So keep in mind, this field exists for you here. You've got lots of different options for relationship. Okay, we're going to say continue. This is a new question. So this Medicare eligibility question, brand new, you'll see there is also a little tooltip here if you need any help. But what we heard from agents for a long time is, hey, if I have consumers that are aging on to Medicare, it's a really clunky process to get their subsidy portion of their ACA enrollment canceled. I have to call the marketplace, and a lot of times those effective dates don't really dovetail. So CMS actually added this question to the application. So if you have a consumer that has Medicare starting soon, or that maybe started recently, you can go ahead and list that here now, and it will help you to dovetail that termination date for the ACA coverage with their upcoming, Medicare effectuation date. This question will be available for all applicants on the application. If it simply doesn't apply, you just skip it. Just don't check the box. Okay, we'll say we're not married. We do plan to file taxes. We're not claiming dependents. If we were, they would say, great, is it the neighbor's niece that you already told me about, or is it someone else? I can still add new dependents here, but I don't have to rekey any information that the platform already has on file. I can simply choose to use it or enter additional information. Okay, again, because we're using a shared, just kind of testing social, it looks like this is already saved from before. So we're going to say no here. We don't live with anyone under the age of 19. We haven't used tobacco 4 or more times, but look, you still have your nice little help icon if you need that. We are a U.S. citizen, but keep in mind, if you're helping a consumer who is not a U.S. citizen, and perhaps they don't have a social, if you select no here, you will then be able to enter all of the immigration documentation information. So this is how you would do that for those non-U.S. citizens when you're assisting those consumers. Okay, we're not currently incarcerated, detained, or jailed. You'll notice there's a help icon here for you as well. We're not an American Indian or Alaska Native, and we don't feel like answering the Hispanic, Latino, Spanish origin, race, or ethnicity questions today. One quick call out is, see on the left-hand side, you're getting these cute little check boxes along the way. I can hop back into a section anytime I want, but see how right now it almost looks like it's duplicating my customer. It's actually just on a second page of questions related to this consumer. We get that question a lot over in agent support, so just wanted to call your attention there. If I'm not sure what this is, I can hover. That's okay. Okay, again, because we're using that testing social, it looks like we have some income already on file for the social security number. So if you're updating an existing application, yours may look like this. Today, we're going to edit this so you can kind of see what it looks like top to bottom. One thing I think is super cool about the income section is there's a really long list of stuff that you're supposed to include for income, and then there's an equally long list of stuff you're not supposed to include for income. I don't have that list memorized. I don't know about you, but what we do is we just let the list live right here within the platform. So whenever you expand this, you'll get a nice reminder. What do you include? What do you not include, right? Don't include this stuff. What about income you're not getting this month? What if my consumer had a job for January and February and they're actually unemployed right now? How do I care for that, right? It's not income they're getting today. So what do? Great. This actually tells me exactly how to answer certain questions to care for that. So it's really nice that it all just lives exactly in one place for you. You don't have to go looking for all those lists. So we're going to say, yes, we do get income. My consumer does get income from a job, but I'm going to remove that so that I can show you how to add this. Let's see if it'll let me. Okay, here we go. We'll add a new source of income. We've got lots of different options here. We even have an other category at the bottom, so you can really help your consumer care for anything they need to care for. And we're going to say the Joker today. Okay, I guess we should capitalize this. The other really nice thing here is I don't have to do the fast math. If my consumer gets paid hourly, they make 15 bucks an hour and they work 30 hours a week, I can key this in exactly as they're telling it to me. I don't need to get out my calculator and figure it all out. I don't have to do that. The platform will absolutely do that. So we're going to take the happy path today. Okay, we'll save that. If I need to edit this, remove it, I can add additional sources of income, do whatever you need to do here. If we have any deductions, we'll list those out. You'll see we can add the type of deduction. And then when we get to the yearly income section, basically it's taking the income you gave us and it's subtracting the deductions. And it's saying, hey, is that about right? Does that look close? If your consumer, for example, had that income from January and February that they're not getting now, you would just select no here. And you would say, no, it's not hard to predict. They just also earned like $4 extra grand. So it's actually going to be 39,000. So it's really, again, you can go back to that little drop-down caret in the income section up here, and we give you the steps of how to answer this. But just know that this is really just built into the platform for you to help you along the way. Oh, it looks like let's back out of it slowly. Looks like our staging environment is not cooperating today. So we're going to skip that, but typically you would be able to simply hit save. Now, the way the additional questions section works is if the answer is yes, you check the box. If the answer is no, or I don't want to talk about it, right? Similar to the Medicare question, you'll see some of these are optional. You leave the box alone. So if your consumer doesn't want to talk about extra help, that's okay. You don't have to answer those. What about Medicaid or CHIP? Kid care, right? If that's ending soon, these are dynamic date ranges, by the way. They're looking at today's date. Today is April 15th, and they're calculating the possible special enrollment period window of that qualifying life event. So that, again, you don't have to go do that fast math. If the answer is yes here, we can go ahead and fill this in for our consumer. If it ended recently, we have subsequent follow-up questions. So the platform's going to hide all the subsequent stuff if they're not relevant for you, right? If you've said, no, it's not applicable, or no, I don't want to talk about it. Are we currently enrolled in health coverage? Well, today is April 15th, so we're outside of the open enrollment window. Luckily, our consumer is already enrolled in coverage, and their coverage is actually going to be ending before the 14th of June. They're actually going to be eligible for a special enrollment period, which is why they're contacting us today, right? They're having this qualifying life event. We don't need any information about health reimbursement arrangements or ICRAs. We're not going to be offered coverage through perhaps a new job. So Harley Quinn's coverage is going to be ending before the 14th of June. Wouldn't you know it, it's actually going to be ending on the 13th of June. What about anything else? Why does this section matter? Well, we know that there are a lot of different qualifying life events that can pop special enrollment periods open for consumers. Some of those qualifying life events will warrant different effective dates for plans. So it's also really important if maybe the neighbor's niece was adopted on April 1st, that we go ahead and key that in as well, because that could impact the effective date for the neighbor's niece, whereas Harley Quinn's effective date may be based on this upcoming loss of coverage. So it's really important that you answer all of these questions for all of the folks on the application as accurately as possible. And if you have questions on special enrollment periods or qualifying life events, feel free to pop your question into the Q&A section of our webinar. Okay, again, if we've been offered an ICRA or a Coursera, we can key in this information exactly as my consumer's employer has given it to them. This will determine affordability. And then, of course, an optional tax filing question. This is a new question from CMS as of last open enrollment. So we know that consumers who have received advanced premium tax credits over the past couple of years, if they haven't filed their taxes over the past couple of years or reconciled those payments, they may no longer be eligible to receive those. So it's really important that you cruise through that with your consumer. We have these nice little edit buttons along the way on our finalized screen, or again, we can pop back into a section. Whatever you need to do here is fine. You'll review this with your customer. You will read all of these agreements and attestations. Please don't summarize them the way that we are today. Please read these. So we just want our eligibility to renew for our tax credits. We know we need to file our taxes. We know if something changes, we have to tell somebody about it. And we understand all of these departments talk, right? Marketplace, Medicaid, Medicare. So of course, we're gonna go ahead and key our consumer's name in to electronically sign on their behalf, and then we'll get our eligibility results. Now, what I think is helpful about the eligibility results page is it gives me a nice summary of the eligibility results. It also allows me to start educating my consumer on what some of this stuff means if I haven't already had a chance to do so. What do we mean by that? First things first, my consumer is going to be eligible for a special enrollment period. Great, congratulations. Do they know what that is? Right? If not, it might be a good time to kind of take them aside and educate them. They're eligible for a tax credit. Those are those advanced premium tax credit dollars that can go toward the monthly payment. Spoiler, they're eligible to receive up to $490. They don't have to take all this. I'll show you how they can edit that in a moment. And silver, look at this, cost share reduction. They're eligible for lower deductibles and out-of-pocket limits on those silver plans. If you haven't had a chance to do so, start educating them on cost share reductions. See if that is within their budget. We're going to download our eligibility letter, and then we will review our plan. Now, again, because we are using that shared testing social, we are going to land on our plan results page. Perfect. Good. So otherwise, you might need to review their current plan selection. You can change their plan selection. Goal is to land right here back on our plan results page. You'll recall we saw this whenever we were looking at our quota, right? It's the same plan results page. So we review this with our consumer and they say, okay, good. I actually, now that we understand about silver plans, I want to definitely go with the silver, and this one looks great. So we're going to go ahead and add this to our cart. And now we are on our confirmation screen. What's cool about this screen are a couple different things. Number one, if my consumer doesn't want to use all of their advanced premium tax credit dollars, they don't have to. We can uncheck this box. They can use whatever amount they want. They can use nothing. Just because your consumer is eligible to receive subsidy dollars does not mean they have to take them. A lot of consumers are giving you their best guess when it comes to their income, and their income may be really, really flexible and hard to predict. So it's really important to understand that they don't have to use all of these if they are not comfortable doing that. Not all consumers want to be at risk of paying those dollars back if their income is kind of wildly different by the end of the year. The other really cool thing that we have available here is this second portion of consent, this eligibility application review consent. So perhaps you already have that in your own records. We simply condense it for you because we kind of just assume at best, you have it in your own records. You can, of course, expand that. So perhaps you want to go ahead and email this enrollment review to your consumer. You want to text it. Perhaps you do have it in your own records. You just want to upload it, right? Maybe it's a phone call recording. Maybe you just want to store it on your own. Whatever you want to do here is okay. Just make sure that you absolutely have this eligibility application review documented in a manner that meets all of the CMS requirements. Okay, and we are going to go ahead and enroll in this plan. We're going to submit our application, and then we will be able to, oh good, we've actually hit our invalid action error. This is a CMS invalid action error. You'll notice it's called that. This means that I'm trying to update or change an application that actually, the change that I'm trying to make could adjust the NPN or lack thereof that's already on that application. So I'm actually not going to be able to proceed on my own. I'm going to need to go ahead and send this resume link to my consumer so that they can finalize their enrollment. I'm going to need them to get involved, really to minimize that risk of fraud. So that we can show you your dashboard, I'm going to come back to dashboard, and we'll click on another applicant here so that you can see what the client details page looks like. So once you do get that application submitted, you will land back in your dashboard and you can view your client details page. A couple cool callouts on the client details page is at the top, you actually have a follow-up section. So the reason this is super helpful is this can be really difficult to manage, right? We know that there are a lot of different types of documents customers can submit to satisfy all kinds of different follow-ups that an application could generate. We list the different follow-up actions for you right here. And when you actually click into a follow-up item, first things first, we'll remind you which one you clicked into up at the top. When this finishes loading, this is really nice to see. The other cool thing is we actually list, so it reminds you, we clicked on loss of coverage. You'll recall there was also a verify citizenship, right? So we've clicked on loss of coverage. We also just embed the list of acceptable documents to verify the specific item you clicked into right here for you. So again, you don't have to go looking for all these different lists. If we clicked on citizenship, we would get a totally different list of acceptable documents to pick from. So it's really nice that everything just lives together. I can select my document type, select my file, and get that uploaded to ensure my consumer works toward effectuation. So it's really, really nice to have everything all in one place. You can see the application, you can view or edit their existing application, you can view the plan that they've selected. So if they contact you in March and say, gosh, did I pick the plan with, or I guess in May, we're in April. If they contact you and say, gosh, what was my copay again? I don't remember. You can view their plan details here. You can see their enrollment history, consent records. This is especially cool that consent records live within the client details page. In addition to that consent library, you can actually look client by client and see exactly which consent items you have on file for that consumer. You can even upload new consent forms if you need to do that. So anytime you need to update those for your consumer, that's an easy upload. If I've emailed consent to my consumer, I can resend an email from here. So really nice that everything lives all in one place for you. And then of course, marketplace notices. We've got our eligibility letter here. If we need to grab last year's 1095A form, we can do that. So really cool that this is just a nice, user-friendly, digestible view of everything that could be going on within your client. You can get into their household and even leave notes for yourself. Nice little comments for next time they contact you. And that is the application within Sherpa. So we're going to go ahead and pop back into our slideshow and let's just talk about some resources. So in the top right corner of your dashboard, there was that little circle with the question mark inside. When you hover over that, you've got lots of different options available. You've got a running list of new product updates, feature releases. We've got a getting started guide, our help center. It's really just a list of articles that answer frequently asked questions. You can filter by searching. It's really cool. And then, of course, a link to our agent training help article. Feel free to pop in, view other webinars we offer, watch recordings, really just see what we've got going on anytime. And of course, the contact info for agent support. Let's just talk briefly again about contacting agent support if you need help. Feel free to frame this slide, make it your desktop background. Anytime you have questions about a particular feature, you need to report a technical issue, call us, send us an email. You can even chat with us directly from your dashboard. Agent support's phone number, it's also just listed on our main Sherpa website. So if you're struggling to even build your account, that's okay. Just look up at the top of your web page there and just give us a call. We are happy, happy, happy to help you with that. We've also just tagged a few help articles and resources that answer some common agent questions if they prove useful. So if you're new to the ACA, you want to learn more about just getting started, we have a help article for you here. If you want to learn more about special enrollment periods and qualifying life events, this is going to be a really great article for you about writing applications outside of open enrollment. If you want to learn more about uploading follow-up documents, and you'll see a lot of these other questions have resource articles tagged. Okay, we're going to spend the remainder of our time together answering your questions. So if you haven't already had a chance to do so, please be sure and pop your question into the Q&A feature of today's webinar. I want to make sure we leave all of you on the most important.
All right, we're going to stop it there. So we got one question. So let me first say, guys, hold on one sec. Okay, all right, so just want to leave my info up here now. So guys, if I just want to say that Health Sherpa is super user friendly. Okay, if you haven't created an account yet or haven't done an application at all, I can see that video could be a little overwhelming. But again, once you get into it and just playing around with the system and start actually enrolling people, it is so user friendly. It asks you every question line by line. You can't really miss a beat. If you do mess up, it won't let you move forward. So there's always that too. Now, I got one question in the chat so far. Is this available for New York? Okay, so let me explain a little bit about Health Sherpa. As I mentioned in the beginning, Health Sherpa allows you access to sell as long as you have the state license or non-resident state license in that state. It allows you to sell or write policies in all of the states that are on the federal exchange. Okay, so let me just break that down. All across the country, every state is either still on the federal exchange or they have their own private exchange, marketplace rather. Okay, so one question I have from Stephen here is this available in New York? So New York is one of the private exchanges. So for New York, Connecticut, New Jersey, Pennsylvania, they all have private exchanges. California has their own. There's 20 states right now that have their own private exchanges. And there's almost 30 states that you can sell as long as you have the non-resident licenses in those states. You can sell on Health Sherpa. That gives you access to the federal exchanges. So that gives you access to the heavy hitters to like Texas and Florida. But also, I can't fail to mention, though, that the private exchanges like New York, well, not necessarily New York. New York's a little tricky, but Connecticut, New Jersey, Pennsylvania, California, New Mexico, Nevada, those private exchanges are actually pretty good for you guys, too. There's less competition. There's less agents in those pools. And also the business tends to stay on your book better retention of your business because there's less competition because they're private state exchanges. So like you saw or heard Amber talking about avoiding fraud towards the end there, where it gave an error message, right, to send the resume link or the invalid action, right? That's what happens at the end because a lot of people a while ago, last year, 2023, were basically just going in without consumer consent and just taking plans over, rewriting them for their own and doing it. That does not happen anymore. And that's one of the reasons why, because towards the end, you either get that invalid action code if you're trying to change the NPN on a plan, and either you have to do a 3-way call with the federal government with healthcare.gov for them to hear the consumer on the phone with you give their consent for you to now be their agent of record, or you can text or email it. So they do have to sign something for it. Okay, so that really takes care of that whole problem. So accounts or policies aren't being rewritten or overwritten by anybody else changing your MPN to theirs type of thing. Okay, so again, Health Sherpa gives you access to all the states on the federal exchange, and then all the other states, 20 states right now, have private exchanges, except with the one exception of Georgia. Georgia had just recently gone private. They were on the federal exchange, and they just recently went private. However, some reason, I'm sure they might be working on this for other states too, you can actually get through a Georgia consumer as well. You could write them also on Health Sherpa. It gives you a link to go into the Georgia site, which you still have to take a separate training for and make sure that you're eligible to sell on the Georgia private exchange, but you can also do it through Health Sherpa. No other private exchange state is done like that through Health Sherpa, but they made an exception with Georgia because it used to be on the federal exchange, and they just recently went private. So, Stephen, if you're still on, I hope you heard me. Not for New York. Health Sherpa, you cannot do any New York policies on, because they are their own private exchange. Now, I can help guys with anything else. If you want to do a real life situation where you have a client, I can help you through the application. Anything. I am here for any of that. Anything ACA related, I am always here for you. So any other questions right now? I don't see any. Oh, I have a few more. Okay, here we go. Yep, I think think GA is private but is available in Health Sherpa. Yep, exactly what I just mentioned. GA is the only state right now that you can do that. Again, New York State. I have another question from Stephen about New York State to sign up for MAPD, Medicare Advantage, or prescription drug plans, supplement plans. So I will say one thing, Stephen, I'm not a Medicare expert at all, especially when it comes to Health Sherpa. They do have a whole Medicare side now, though. They didn't always, but they do now. So I would check. Now, one thing I will say, I'm sure you guys have noticed or recognized that Amber, she is awesome. Now, that was a recorded webinar and a recorded video. Once you have your account set up on Health Sherpa, everybody has full access to those trainings. Again, just in the top right, under agent training, under the question mark, right? Then agent training, and then you have all the webinars, all the video trainings that they've given. You have access to those. So Stephen, my advice for you, just make sure, just give them a call. What I was going to say is their customer service, their training, everything is top notch. I mean, customer service wise, just giving them a call. Again, you can call me at the number on your screen right now. But if you want to call them directly, that works too. They are fantastic. You do not wait very long for a live person at all, and they are really great with answering questions. So definitely get in touch with them for Medicare issues. So that's that. I don't see any other questions. I'll leave it open for another minute or so, but please, guys, get in touch with me. If you're not in the ACA world yet, I'd love to help you out. Pinnacle can do a lot for your business. We can definitely help you. And again, I could do real live demonstrations or work through real life situations with you anytime. All right, so I'll leave it open for a little bit more, but I got another one. Oh, thank you. You're welcome. I'm glad if you guys were here last month, this didn't go so well. So many tech issues and nobody heard anything, but today went great. I really appreciate everybody coming. Let me know. Again, please take down my info. Let me know if you guys have any questions at all, but otherwise, I will end this today. You're welcome, guys. Thank you so much. I appreciate all the comments. But yeah, let me know, guys. Get in touch anytime. Thank you so much. Bye-bye.